Diseases of the pericardium in dogs and cats, and heartworm disease, the symptoms, diagnosis, treatment, and prevention. So pericardium diseases, the congenital is the PPDH, the peritone-neopericardial diaphragmatic hernia, and the acquired diseases are the pericardial effusion and constrictive pericardial disease. And the pericardial surgeries are pericardectomy, pericardial window thoracotomy at the fifth intercostal space, and the percutaneous balloon pericardectomy. In heartworm disease, the overview is it's a pulmonary disease and the vectors are mosquitoes. The symptoms are mild, moderate, severe, and cable syndrome. And the diagnosis is use a PCR and radiograph. The treatment, moxidectin, and also talk about the susceptibility gap. And for prevention, use mosquito repellent and permethrin. Diseases of the pericardium. So the pericardium is two layers, the parietal and visceral layer, and between them is the pericardial sac. The pericardial diseases in animals are rare, with only 1% of cardiac diseases in cats and dogs being pericardial, and it causes right-sided heart failure. And the main congenital disease is peritoneopericardial diaphragmatic hernia, or PPDH. It may be clinically silent, but it can be seen on the X-ray, as the intestines can be in the thorax, and the treatment is a closure of the hernia, and the prognosis is excellent, as long as there's no other complications. And for the acquired diseases, there are two. The first one is pericardial effusion. It's extremely rare. It results in hemopericardium. It's caused by neoplasm or coagulopathy, and it leads to decreased diastatic filling, which causes compensation reflex tachycardia and fluid retention. It's found in large breed dogs over 5 years old, and it results in abdominal distension. The clinical signs are pale mucous membranes and a weak pulse, and muffled or absent heart sounds, and in a chronic form it can form ascites. The treatment is a pericardiocentesis. You need to remove the fluid with a needle, and you can use a guided ultrasound technique, a closed needle, and then the medical treatment is diuretics. You can furosemide. And for the surgery, you do a subtotal pericardectomy. The prognosis is good, but you might have to remove the pericardial fluid several times. This is only if it's idiopathic. If it's caused by hemangiosarcoma, the survival rate is very poor. And the second disease is constrictive pericardial disease. It's caused by a result of a thickening or fusing of the two layers of the pericardium. This, as a result, causes decreased ventricular filling. It's difficult to diagnose, and the clinical signs are the same as pericardial effusion. The best test is the hepatojugular reflux test, and the therapy is a subtotal pericardectomy. The prognosis, if the epipericardium and the pericardium are not fused, the prognosis is good, otherwise it's poor. So in regards of surgery of the pericardium, a pericardectomy is the only surgery you can do. The number one indication is pericardial effusion, when fluid accumulates in the pericardial sacs, leading to gradual compression from the outside. You can do a pericardial window thoracotomy at the fifth intercostal space. It's the easiest and smallest technique. Another technique is a subtotal pericardectomy. It's more aggressive than the pericardial window, but you also go through the fifth intercostal space and you resect the pericardium from right underneath the phrenic nerve, and as a consequence the fluid goes through the pericardial sac and can be reabsorbed easier. And a percutaneous balloon pericardectomy is when a balloon catheter goes into the lumen and is inflated and tears a hole for fluid drainage. Post-operation, the drainage should be there for 24 hours. The prognosis post-operation, if there's no other comorbidity, it's good, and bacterial pericarditis is good with long-lasting antibiotics. Heartworm disease, the symptoms, the diagnosis, the treatment, and the prevention. So heartworm disease is a pulmonary disease. The right side of the heart is only involved at later stages. The heartworms are Diafilaria immitis, and the primary vector is the Culicidae mosquitoes, and their host is the domestic dog and some wild canids. So the pathophysiology. Adult heartworms provoke reactive vascular lesions. They reduce vascular compliance and make the lumen smaller. The disease depends on the number of heartworms and how long they've been present and the animal's reaction to them. Dogs with high activity levels have more severe symptoms. The villus myointimal proliferation begins 3 to 4 weeks after the adult worms. The villus myointimal proliferation induces endothelial damage. This can lead to thrombosis and pulmonary thromboembolism. This can cause perivascular tissue reactions and edema. Lesions can cause interstitial and alveolar infiltration, which can be seen on thoracic X-rays. And the vasoconstriction is caused by hypoxia. The end effect is increased pulmonary resistance and pulmonary hypertension. Dead worms stimulate an even greater host response and worsen the pulmonary disease. The fragments of worms and thrombi create an embolism and inflammation, which leads to fibrosis due to right-sided congestive heart failure. So the cardiovascular consequences of heartworms are a series of pulmonary alterations, especially pulmonary hypertonia and chronic pressure overload, which leads to right ventricle dilation, which leads to concentric hypertrophy and increased right ventricle diastolic pressure. This can cause tricuspid insufficiency, which leads to regurgitation. In severe cases, upstream migration to the pulmonary trunk and the right side of the heart, such as the right atrium and the right ventricle, even into the vena cava, is the most serious form of heartworm disease. It's called cable syndrome. The consequences of heartworm disease on other organs are liver damage, which is cirrhosis due to right-sided congestive heart failure, and glomerulonephritis due to the circulating immune complexes. There are 4 clinical categories of heartworm disease. Number 1 is mild. This can be asymptomatic or a cough. Number 2 is moderate. So cough, exercise intolerance, and when there's auscultation, you can hear abnormal lung sounds, such as crackling and wheezing. Number 3 is severe. This is cough, exercise intolerance, dyspnea, abnormal heart and lung sounds, hepatomegaly and reduced blood flow to the brain, and right-sided congestive heart failure, such as jugular vein distension and ascites, and edema of the ventral abdomen. And category number 4 is cable syndrome. Small dogs are most prone. This is when adult worms are displaced from the pulmonary arteries to the right side of the heart. The diagnostic tests are lab diagnostics to detect dirofilaria and the modified NOT test to detect microfilaria. You can detect the DNA of the worms with a PCR. This is gold standard. And with diagnostic imaging, radiography is the most important step of diagnosing heartworm. It supports the diagnosis and it judges the severity, so you can tell whether it's stage 1, 2, 3, or 4. And ECG, echocardiography, is important for diagnosing cable syndrome. The ECG signs of a right atrium enlargement means tall P waves, and if the ECG signs a right ventricle enlargement, expect to see small R waves and large S waves. The treatment of heartworm disease. So you want to improve the clinical condition of the animal and eliminate all stages of the heartworms, microfilaria, larval stages, juveniles, and adults. Dogs with significant clinical signs of heartworm disease should be stabilized before you give an adulticide and killing the adults. This may require giving glucocorticoids and diuretics and vasodilators, because as the worms die, they decompose and the fragments lodge in the distal pulmonary arterioles and capillary beds. And this can block the blood flow and cause inflammation and platelet aggregation and cause a thromboembolism. Increased exercise can cause these vessels and capillaries to rupture. So an example of a treatment plan is day 1, you give macrocyclic lactone, or prefer moxidectin for microfilaria. Never give a macrocyclic lactone before giving a blood test for parasites. Then on day 1, you can also give doxycycline for 28 days, no repeat, against Wolbachia. Always give a probiotic with doxycycline. On day 60, which is 2 months later, you can give melosormine as an intramuscular injection. It's painful and deep for adult females in 3 injections on day 60, day 90, and day 91. And then give melosormine 2 on day 90, 91, melosormine 3, and heparin. And on day 120, test for the presence of microfilaria. There is such thing as a susceptibility gap between day 30 and 120 when the Dirofilaria immitis, the heartworm, is not considered to be susceptible to either moxidectin or melarosomine. You can minimize the susceptibility gap by giving moxidectin 2 months before melarosomine. This will reduce new infections and eliminate existing larvae. It will also allow older worms to mature to a point where they're more susceptible to melosormine. Macrocyclic lactones like ivermectin are given as microfilaricides, can cause rapid decreased numbers of the microfilaria, and should be used with caution in dogs with high numbers of microfilaria. Pre-treatment with antihistamines and glucocorticoids can minimize potential reactions. The prevention of heartworm. Before using any prophylactic treatment, you must rule out dirofilaria infection by testing for circulating antigens or microfilaria. No PCR is possible without microfilariaemia. If heartworm is positive, the animal must be treated for adult worms for 4 weeks before prophylactic treatment can start. Another good prevention are mosquito repellents, such as permethrin.